Well, thank you very much indeed for the opportunity to speak to you at this really important conference dealing with issues that are so relevant to ethnic minority women in the Welsh NHS and in the Welsh healthcare system. All of these issues, workforce issues, healthcare issues, discrimination issues, really came to the fore during the coronavirus experience. Coronavirus is not over. Many people in Wales are ill with the condition today, and over 1,000 people in this last week have not been in work in our National Health Service because of coronavirus. What we learnt during the experience, of course, was that the impact of the disease does not fall equally on all parts of the population. And thanks to the pioneering leadership of clinicians in the Welsh NHS, many of whom were women, we were able to mount a response to the unequal impact of COVID-19 on our black and minority ethnic communities here in Wales. And I'm hugely grateful for the enormous effort that was made, both to make sure that we were better able to protect people in the workforce, but also to get that vaccination message out to our different communities. There's still a gap that we need to work on and to erode, but that gap is much narrower than it would have been had it not been for all those enormous efforts. Now, the COVID-19 experience was also pivotal in making sure that we worked on a wider plan, the Anti-Racist Wales Action Plan, as it has become, committing the Welsh Government to action to address discrimination, not simply in healthcare, but in all those wider dimensions of life here in Wales. And one of the really big differences in this plan is the way in which it has been informed by the lived experience of people who day in and day out have to deal with these issues in their daily lives. Now, as well as grappling with those fundamental issues of life chances, of housing, of employment, of education, of course, the Anti-Racist Wales Action Plan has things to say about healthcare as well, particularly from that public health perspective. We know that, beyond coronavirus, health conditions are differentially felt in different parts of the population. And everything that we can do to make a difference in the fields of diabetes and of health and heart care, the things that we can do in relation to diet, to exercise, to smoking, all those things will have a differentially positive impact in the lives of our black and minority ethnic communities. And all of that is set out in the Anti-Racist Wales Action Plan. And thank you to all of you who I know have played a really important part in making sure that the plan genuinely captures all the actions that we can take together in that way. The plan is more than physical health, of course. Coronavirus itself has had a real impact on the mental health and well-being of communities across Wales. And in the plan, we set out those particular actions and those particular projects that we have in place here in Wales. The Women Connect project, particularly important in communities where there are concentrations of women from black and minority ethnic communities, and the Time to Change Wales project, action that we can take together to tackle the underlying sense of stigma and discrimination that far too often still clings to people who feel they have a mental health condition and a need that our health service and our third sector organisations can help to address. We know as well that in the NHS itself, where so many of our services depend upon people working who come from black and minority ethnic backgrounds, and women particularly represented in that, the NHS itself needs to grasp this agenda. It needs to do more to make sure that the contribution that is made by people from black and minority ethnic communities is recognised and rewarded. It needs to make sure that that happens from the ward to the board level, and it needs to make sure that the services that our fantastic NHS provides are felt by black and minority ethnic users, that the services are felt to be accessible to those populations and delivered in a way that makes those populations feel comfortable in using the services that are there for them. And everything that you will talk about today and everything that you do to help us to make sure that an anti-racist Wales has an anti-racist NHS will be powerfully felt in the way that we develop those services over the years that lie ahead. Let me end by assuring you that the Welsh Government remains entirely committed to combating racism and its root causes here in Wales. Words are not enough. We need to follow through on the practical and systematic changes that will help us to make this happen. And if that is to happen, we need your help. We want to work with our magnificent NHS workforce, itself the clearest and proudest example of diversity at work in Wales, to achieve systematic change and to eradicate racism wherever we see it. I hope that you will have a very successful conference, and diolch yn fawr o galon I chi gyd.